On behalf of Dr. George Saris, President of the European Congenital Surgical Heart Association, and me, we would like to welcome our respective societies members, colleagues, and friends from the United States, Europe, and all around the world for the 5th Joint CHSS-EXA meeting. We have all been challenged with the wrath of this COVID pandemic, and our thoughts and continued support goes to each and every one who has been or is currently affected by this raging disease. There is a silver lining. Our two societies and the entire specialty, with all of our multidisciplinary colleagues, have worked together to better understand the issues and find solutions to better triage and treat our patients. We have taken advantage of the virtual platform and have stayed educated and connected. We have contributed to the literature. We have learned from each other, we have supported each other, and we have come closer together as a specialty, and patient care is better as a result. Cardiac surgery is a specialty about managing pressure, and for pediatric cardiac surgeons, the greater the pressure, the better the performance. We should all be proud of our performance during these unforeseen circumstances, and the content of this meeting will showcase some of these meaningful contributions. We encourage you to visit our exhibitors, sponsors, and e-posters by clicking on the digital marketplace at the top of this window, and would like to thank them again for their ongoing support of our societies. We would personally like to thank the following companies for their support for the 2020 virtual annual meeting. Our gold level sponsors, Berlin Heart and Gore Associates. Silver, Medtronic. And bronze, Azio Biologics, Covalon Technologies, Sanofi, and Scanlon. Thank you all. Now I'd like to turn it over to Dr. Varicella, who will start the program. Thank you and welcome.
Hello, everyone. On behalf of the Scientific Program Committee, I would like to welcome our society's members, guests, colleagues, and friends in the US, Europe, and those who are turning in from other continents to the 5th Joint CHSS and EXA meeting. In the interest of everyone's safety, the meeting is held this time around on a virtual platform. We're of course looking forward to a hopefully imminent time in which we will be able to meet again in person to bring our experiences together and advance our field. Before we get started with session 1, I have a couple of housekeeping items to go over with you. If you're having any connection difficulties during this event, make sure your Wi-Fi signal is strong. Google Chrome is the preferred web browser for this virtual platform, so you may want to consider opening the event link in Chrome. We encourage you to participate in each session by using the Q&A functionality, which is the window to the right of my web camera image. Just click the blue Ask a Question button to get started. It will ask you to join the Q&A session, and you will need to type in your name and then click the Join tab. This is not a chat room to catch up with colleagues, and don't wait until a video presentation is over to type in your questions. You can type them in at any time. The session moderators are in charge of the Q&A segments, so I ask our presenters to be sure to turn on their web cameras and unmute their microphones as soon as the video presentation has finished playing. The CHSS and EXA Joint Virtual Annual Meeting is offering a maximum of 8 AMA PRA Category 1 credits. Physicians should claim only the credit commensurate to the extent of their participation in the activity. You will receive a post-meeting evaluation survey within 1 week of the completion of the meeting. Once you complete the brief evaluation summary, you will be able to retrieve and print out the certificate for your attendance. For our presenters, we also encourage you to submit the finished work of your abstracts for publication in the World Journal of Pediatric and Congenital Heart Surgery, the only journal specifically dedicated to our field in the official journal of both societies. Finally, if you miss any presentations today or tomorrow, we will be making all of the sessions available in an on-demand library in the coming weeks. I'd now like to ask our session 1 moderators to turn on their webcams and unmute their microphones. Dr. Rachel Vanderland and Vladimir Ovida will moderate session 1.